But let's talk about something totally different now. We're going. You've read this story as well? It's interesting,
weird,
and I'm not sure what I make of it. So I'm very excited to speak to our guest, Dr. Lindsay Browning, about it. She's a psychologist, a neuroscientist, and a sleep expert who holds a doctorate in insomnia from the University of Oxford. Hello, Lindsay. Thanks for being with us.
Hello, no worries.
Now, you're here, Lindsay, because we're talking about snoring, and for many people it gets in the way of a good night's sleep, right? But this study from India, Lindsay, was suggesting that the ancient ritual of blowing into a large shell could actually improve sleep for patients with obstructive sleep apnea without the need for medicine. Now, when I read that, first of all, Lindsay, I'll be honest, I was a little bit sceptical. So tell us a bit more about it. What is going on here?
Sure. So snoring is more than just a bedtime annoyance. For some people, it's a sign of obstructive sleep apnea, where your airway becomes blocked repeatedly through the night. And when you stop breathing because your airway is blocked, you start to wake up, and that disrupts and fragments your sleep, which can cause really severe issues to fatigue during the day because you're just not getting a good night's sleep, as well as causing issues to increase your risk of heart disease, stroke, that kind of thing. So this study, it's a very small study. It's on 30 people. And what they did is that they divided these 30 people and gave some of them who were experiencing this obstructive sleep apnea these conch shells to blow in a particular skill called Shankh blowing. And it just means it's a particularly vigorous way of blowing out, which is kind of like a gym for your throat muscles. And what they found is that in this very, very small study, that the blowing through the conch shells increased the muscle tone of the throat so that the airway was less likely to collapse during sleep. And they found that people who did this had a little bit less number of sleep apnea attacks per hour, and that they reported less fatigue. However, it's a really, really small study, so there really isn't a lot that we can draw from it right now. But the idea that strengthening your muscle tone in your throat is likely to keep the airway open fits with things like women's have an increased risk of obstructive sleep apnea after menopause, because once women have gone through menopause, their muscle tone can start to become less rigid and less strong, which means that the airways in the throat is more likely to close up during the night. So basically, yes, increasing the strength of your throat muscles is likely to help somewhat. However, severe sleep apnea is likely to be needing a CPAP machine to be treated properly.
Right. So let's go back to the the conch shell then, Lindsay. For people who don't know, a conch shell is if you were to put a shell in a Disney movie and have somebody blow it, that's the very picturesque sort of long shells that you see.
Very twirly and very large and very beautiful looking.
They're very. I mean, sometimes used as ornaments, aren't they?
Yeah, I'm just thinking about all the stuff that I've got in my house, and there's a lot of stuff in my house. I don't think I have one of these conch shells.
Well, you could find something else, because essentially what you're saying, Lindsay, that the shell is just a nice way of sort of getting the story out there, that essentially you need to be strengthening your muscles, right? That's the gist?
Yes, and of course, if we can strengthen our throat muscles, it's likely to decrease the risk of sleep apnea because your throat muscles are stronger and they can stay open during the night. And of course, blowing into a fancy, beautiful shell, that's fun. It's less invasive, and it may be that if we start helping people to work on their throat muscles before going to the sort of hardcore approach of curing sleep apnea, or treating it rather, with a CPAP machine, which continually makes sure that the airway is flowing through the night. If we can do things that are less invasive and easier, great. But of course, we need to speak to a specialist. I don't want people to just go, oh, well, I have snoring or sleep apnea, I'll just go and get one of these shells, because A, we need more studies, and B, we really need people to get checked out by a professional to see what's really going on and get the right treatment.
It's a conversation, because it certainly got us talking in the office, Lindsay. Right? So it's definitely a conversation starter. Do you? I mean, I think I know what you're going to say here, but do you think that we take sleep seriously enough as a society at the moment? Do you feel like we give it the sort of attention it deserves? Because you hear all the time when you get experts like you on the program and you chat to you, like, we don't think about this stuff enough, in terms of like healing and what it does for you as as a human to feel better if you sleep properly.
It's one of those things that you don't think about until it breaks, until it goes wrong. So if you're someone who's sleeping fine, it'll be something that you don't even think about, and you'll probably sacrifice when you're having too much fun out with your friends at a night, or you'll be working really hard. But as soon as somebody starts to struggle with their sleep, they start to toss and turn, they can't fall asleep, tonight, for example, I mean, tonight and tomorrow night, there's likely to be a heat wave in the UK. I expect a lot of people in the UK to struggle to sleep tonight. So actually, today, tomorrow is a time when people are probably going to be thinking about their sleep. They might wake up tomorrow, the next day, having had a really poor night's sleep because they couldn't sleep because of the heat, and really appreciate how much better they feel after a good night's sleep.
And some people might want to get the old conch shell out and give it a go, but not instead of going to see a doctor if you were concerned about it.
Not
Lindsay.
instead.
Thank you very much for coming on and giving us your expertise and your insight on this. That was Dr. Lindsay Browning, their psychologist, neuroscientist, sleep expert, and someone with a knowledge of the old conch shell and how it can help.
The old nighttime regimes are getting more complicated, though, aren't they? Skincare, moisturise, brush your teeth, blow into your conch shell. It's quite a lot.
It's quite a lot.